We are visiting today in Washington, D.C. and meeting with Rachel Fay, who is the Director of Policy for Power to Decide. Before we get started, I want to go ahead and just kind of lay the groundwork. We are here today to learn about their program and what it is that they do on the Hill, and also to give people a little bit of a behind the curtain view of how these folks actually work here in DC. But what we are not doing is talking about endorsements, right? We're trying to share information and make sure that we get speakers here that are helpful and informative, but we're not focused on the political aspects of things. So now with that disclaimer, let's go ahead and move forward, and I'm gonna let you introduce yourself because you know your background and really what is the messaging of your program.
Great. Well, so my name is Rachel Fay. I'm the Director of Public Policy at Power to Decide. I've been with the organization in a variety of different roles for about 9 years. My role is principally to manage our healthcare portfolio. So that includes everything from lobbying on access to birth control and abortion to working on ensuring that all young people have high quality evidence-based sex ed, to making sure that people have health coverage, because without that coverage they can't get the birth control and the other reproductive health care they need. So it's a big portfolio. Not a lot happening in our issues, of course, right? And Power to Decide, I think, is a really special organization. So at Power to Decide, we have a simple belief that everyone, no matter who they are or where they live or how much money they make, deserves to have the power to decide if, when, and under what circumstances they want to get pregnant and have a child. And if you think about that, that's at the root of so many other ways in which we plan our lives, build our families, chart our careers. So we sort of think of this as a ground zero kind of decision for everyone, and making sure that they actually have the information, the access, and the sense of opportunity to act on their own decisions and their own goals when it comes to that is really what we as an organization are about. So on a day-to-day basis, I spend a lot of my time lobbying, which sounds like a really, I think people think of lobbying and they hear Jack Abramoff and paper bags of money and all that. And I like to joke, I'm Glinda the Good Witch lobbyist. I work for a 501c3 nonprofit. We don't make campaign contributions or endorsements. We have to win the argument with a policymaker on the merits of the argument, on convincing them that it's good for their constituents. So when you go into lobby, you really are spending a lot of time helping a member and their staff become smart on an issue and give them all the resources and data and information they need to argue the case. So a lot of it is just building yourself as a resource. So a good example is today I was helping some members of Congress prepare for a hearing tomorrow on something called the Title X Family Planning Program, which is really critical. For all of you out there, if you've ever gone to a Planned Parenthood or some other kind of free clinic and gotten free or low-cost birth control, chances are on the back end it was Title $10 that were covering your care if you didn't have insurance. So it's a critical program, and there's a hearing tomorrow on the Hill to talk about some of the attacks that the program has been enduring from the current administration. And I spent most of my day pulling data specific to different congressional districts about what would happen if Title X clinics went away. How many more women would find themselves in what we call contraceptive deserts without access to a clinic in their county that offers the full range of methods. So that's just one example of what we do when we're providing lobbying. It's much more about giving people information and data to make the case than it is, we're going to lean on you right now and we need your boss to vote this way or that kind of thing. That's just not a lot of how it works. So I always feel the need to tell people that, because I think people think of lobbying as this very evil, dark art kind of thing, and it's really not. It's about sharing information and making a persuasive case.
So you're almost like an attorney.
I sometimes joke that I'm not a lawyer, but I play one at work.
Yeah.
But I will say, when I get to the limit of my legal knowledge, I pick up the phone and I call one of my colleagues in our coalition organizations who is a lawyer, and I ask them the question.
Good.
So that's the other thing I would say about our work is organizations don't do this in a vacuum. We work together in coalition, because it would be a waste, for example, of a Hill staffer's time to meet with 8 different organizations all asking for the same thing and making the same case. So instead, we try to complement each other's efforts, pool our resources. So an example recently is that we've been working on improving women's contraceptive access for women in the military. So working with about 10 other organizations that work on reproductive health and rights in one way or another divvying up, who's going to go to what office to talk about why this is important and what it means for women. That's the sort of thing where we try to not reinvent the wheel and rely a lot on each other. So
why have multiple different groups?
Because even though reproductive health might seem like the kind of thing where one group could do all the work, there's a lot of different subspaces within it, as I like to think about. So you've got groups that represent providers, like the American field in order to help inform the policies we advocate for. You have groups like ours that really represent consumers themselves. We have an entire website, which I encourage your viewers to check out, called bedsider.org, which is a site for young women to learn about different methods of birth control, what might be right for them, explore the pros and cons of different methods, and ultimately learn where they can go to get that method near them. And so we think of ourselves as channeling the actual needs of the consumer when it comes to the kind of policy advocacy we do. Or in shorthand, the way we think of it in our policy shop is follow the woman. Think about what is this going to feel like from her perspective?
Right.
What are the barriers she faces? How can we help change policy to eliminate those barriers and make it easier for her to make health choices that are right for her?
Now, what kinds of pushbacks, not to be specific to any individual, but what types of argumentation do you hear?
So I actually think, a lot of people focus on the fight about abortion because it is so divisive. Mm-hmm. But the truth is that if you look at polls over decades, what you really see among Americans is about 15% on the hard right, abortion should be illegal in all circumstances. Never mind if the pregnancy is the result of rape or incest, doesn't matter, illegal. You've got 15% hard left, abortion in any circumstance, we don't care, it's not for us to decide. Everyone else in America, about 70%, is somewhere on a spectrum, between there. Abortion illegal in most cases, but acceptable in some, all the way to abortion legal in most, So when you actually look at that and you peel back the layers, or you look at something like Roe v. Wade, about with birth control, but I don't think I would have told you no.
Right.
So that meant that I only had certain birth control options available to me. And what's right for one person is not right for another. So it's important that people make that decision based on what's right for them, their circumstances, their body, and not because they can afford certain methods and not others.
Right, and that's not just personal preference. That actually
No,
oftentimes
that is absolutely.
a lot of people don't realize that's actually medically based as well.
Oh, absolutely. If you go to Bedsider, we have videos of real women talking about what they like and don't like about their methods, and they're very frank about their journey to how they ended up with that method and why they chose that over something that they may have used in the past. It's also not linear. I mean, I know women who loved IUDs in their 20s and 30s, but now they're only going to wait about a year and a half between children, and they're just like, we can do the pill, you know? So everybody's different, but I think supporting women to make the right decisions for them, for their families, for their goals in terms of their reproductive well-being is really critical, and you can't do that if you don't ensure that regardless of where they get their health care coverage, whether it's through the federal government or whether it's through their employer, that they have meaningful coverage that covers everything that they need. So I think that is, it never fails to astound me how much we get bogged down in the, but I don't like this one little thing, instead of focusing on the fact that Americans by and large agree that birth control is basic health care.
So what's at the root of that? Because that screams to me some sort of human element to this, right? I mean, getting into the weeds of something like that, that's somebody putting their personal belief system or preference on
everybody.
Well, but it's not just that, right? This is a huge holistic solution set, and they're focused on one thing, which usually means somehow, for some reason, I'm focused on this one thing. What is driving that?
I think a variety of things are driving it. It depends on the situation. So a good example is that no copay coverage of birth control really was something that came about as part of the Affordable Care Act. And I think because it was part of the Affordable Care Act, and the Affordable Care Act as a whole was so viciously partisan, a lot of provisions were sort of automatically for some politicians just not something they could get behind.
Right.
I think other fights, for example, who provides it, come down to an objection to the fact that same provider with other dollars provides abortion.
Okay.
So sometimes that's how it should be. You want the FDA to be protecting, consumer safety. But assuming that it goes through all of that, my hope is, one, that it doesn't get politicized the way emergency contraception going over the counter was politicized. And two, I find it really heartening that Republicans, everyone from Ted Cruz, who tweeted at AOC the other day about this, saying that he supported over-the-counter birth control. I think where the devil is always in the details. Yeah. Republican proposals tend to support over-the-counter, but only for those that are 18 and over, which has a problem because, yes, you want some younger than 18 to have access, but it also means a documentation requirement. And some of the very people who are sort of frozen out of the healthcare system are those that would most benefit from an over-the-counter pill, but may or may not have photo ID, government ID. And secondarily, they don't really have any proposal for your insurance to carry over and pay for it. So if the pill goes over the counter, but you have to pay out of pocket for it, then there's a cost barrier, even if there isn't a prescription barrier. So
it's mind-boggling.
So the devil is still in the details, but I am a glass half full kind of person, and I think it's interesting that this is something that has some bipartisan support and has some legs. And I think they will fight about the details, and quite frankly, who wins will come down to how many of each side Congress at the time that it becomes a real proposal. But I do think, over the counter is a nice example
Yeah.
of things that people can start to get behind on both sides of the aisle. And just a hat tip, Congresswoman Ayanna Pressley and Senator Patty Murray introduced their bill, which is really great, talking about over-the-counter access. It's called the Affordability Is Access Act. So I encourage folks to check that out. Encourage your members to get on it. It basically sets the table so that when a pill goes over the counter, there will be a government framework to make sure that coverage carries over with it. So.
Nice. Now I have one last question.
Sure.
Because you touched on it, that we have not a whole lot in the news happening about women's health right now.
That was sarcastic for you who don't know me and don't know that I'm really sarcastic.
That's really where my head is going.
I realize you know that I'm sarcastic.
Oh my goodness. Well, there's so much happening, and really at the root of it, because I've been trying to educate the people around me as well. There's a lot of fear, right? And so, from the top, how do women need to be, and how can we look forward to what we can do to be supportive, and what are the solutions that are looking down the line?
So I will tell you that I think it is a very scary time. I'm not going to sugarcoat that. I think some of these recent bans that were introduced in states like Alabama and Louisiana are designed to end up at the Supreme Court.
Right,
this is a very purposeful strategy to eliminate Roe v. Wade or to overturn Roe v. Wade. And just to sort of set the table, Roe v. Wade federally protects the right to an abortion in the first and second trimester. After that, it defers to the states, and usually the kinds of late-term abortions you see, or abortions later in pregnancy, are really due to severe health risks for the woman or her fetus or both. Right. But that said, I think people need to think about what a world without Roe looks like. And a world without Roe, it would go back to the states to decide. There are several states that have what we call trigger laws, which means the minute Roe v. Wade is no longer the law of the land, abortion is illegal in all circumstances in their state, no ifs, ands, or buts.
Wow, how many do we have with that?
I'd have to check for you, but the Guttmacher Institute maintains good data on this, on what states have what laws on the books. There are also other states that have laws on the books that codify Roe v. Wade, essentially protecting it even if it goes away at the federal level. Maryland is a good example of that. So what ends up happening is you would have a patchwork of abortion access. And in those states where women didn't have access, I don't think it's really going to be a burden for anyone who has sufficient means to travel to a state that does. So we get into a situation where whether or not you have a right to an abortion comes down to how much money you make, which is never how rights should be determined in this country. I'm a strong believer that the high quality of healthcare that I get as a woman is exactly the same amount of high quality healthcare that absolutely every woman in this country deserves to have. So I think women need to be worried about the long term and why they're doing this. But I also think people need to not lose sight of the forest through the trees. There's a lot of immediate attacks that we're seeing. For example, a lot of folks might be familiar with something called the domestic gag rule, which would require any healthcare clinic that receives Title X funding, they can no longer provide abortion unless they do so at a physically separate site. And I just want to talk about how crazy that is. I don't go to one building to get my pap smear and another to get my birth control prescription. I go see a women's health provider and I get my care seamlessly. Nobody should have to have it separated because they don't like a particular service. But second of all, they also require doctors are no longer required to provide what we call non-directive counseling, which is the clinical standard of care where a woman who's pregnant and does not know what she wants to do is given information about adoption, carrying the pregnancy to term, and parenting or abortion, and then helping that woman to sort through what she herself wants, and then referring for whatever services she needs from there on out. And the gag rule would also effectively ban doctors from referring for abortion. So there's a lot. The American Medical Association, which is sort of the authority on all things related to doctors practicing in the U.S., is on some of the lawsuits that are suing the federal government about this rule, as are the American College of Obstetricians and Gynecologists and NIFRA, the National Family Planning and Reproductive Health Association, who represents Title X providers. So this is one of those things I think people don't understand, that Title X is behind that care they're getting when they're 19 years old and they go to the clinic and they're like, I can't tell mom and dad, but I really need birth control.
Yeah.
And no, I don't have a lot of money. I'm in school. You know, that's the kind of thing where Title X is coming in, and no one knows that. They just know, oh, I went to X clinic and I got the care I needed. But without that care, you know, a lot of women, we have some research that shows roughly 19.5 million women in the United States live in a contraceptive desert, where they lack reasonable access to a clinic in their county that offers the full range of contraceptive methods. And I can share this with you for you to share with your followers. Within that 19.5 million, there's 1.6 million women who live in a county without a single health center that offers the full range of methods. If Title X were to go away, that number would go from 1.6 million to 4.3 million. So that's a 160% increase.
Well, yeah.
You know, in the number of women who sort of have no place to go, regardless of whether they have coverage or no coverage. We're talking about low-income women that depend on publicly funded health centers with nowhere to go to get the care. So that's the kind of thing I think that is the more insidious and a more immediate threat. And so we think about something that is used by almost everyone in this country suddenly becoming really hard to access, especially if you don't have money. That to me is a real immediate concern. The other concern for me that I think is really immediate in the realm of reproductive health care is the sort of rampant effort to allow anybody involved in the medical system to not have to provide care if they have some objection to it. It's one thing to allow providers to, you know, say, well, I'm going to choose not to provide abortion in my practice. But imagine if somebody shows up for their care and the front desk clerk won't schedule the appointment because they personally object. That is the level of objection that this administration is trying to push through, a level of what we call refusals. So again, you know, we want our doctors and our nurses, right. We want our doctors and our nurses and the people who went to school and are trained to do this, to make decisions about our healthcare. We do not want the person who's cleaning the room or the person who's scheduling the appointments to start exercising their views in a way that decides what healthcare we can and cannot get. So that's another example of the kind of things that are maybe less sexy than the fight about Roe v. Wade, but just as important in terms of, again, back to following the woman. What barriers does she really face when she goes in the door?
Well, and it gets into a very big government concept, which is interesting and opposite of typically what we hear under this administration. So I am a little surprised to hear we would go that route. But
I mean, right now there's a rule that is, again, being taken to court for the Trump administration to establish something called the Office of Conscience Protection, which is their way of saying any provider or person involved in the healthcare system can come to us when they don't want to provide a service, and we will basically provide them the covered and not provide the service. They're also rolling back a section of the Affordable Care Act that we call the Healthcare Rights Law, which protects, in addition to protecting discrimination based on age or things like that, protects against discrimination based on sex or gender identity. So I think for people who are trans, people who are LGBTQ, this is really scary, because one of the great things about the Affordable Care Act was that it included such strong language protecting people's rights not to be discriminated against when they're getting their health care. So, you can go on for a long time, and these things are people take them very personally. But I think at the end of the day, if you back up to the macro level, I think we all agree we want a healthy country. And we all agree that we want people to act on their own goals and choices when it comes to their health care. But if we don't give them the tools, the coverage, the access to do that, then it's not meaningful. And they don't have meaningful rights. So that's sort of where we as an organization come down, and we get down there in the weeds and fight on individual policies, both positive and negative. But at the end of the day, what we want to do is work towards creating a world where people can act on their own decisions, their own choices with regards to their health care.
That's where the power comes from. Well, this was excellent. Thank you so much.
Lovely.
You were doing amazing work.
Well,
we are so lucky to hear from you.
I'm so thankful for you guys to highlight it. And like I said, I will, check out bedsider.org.
Yes.
That's our consumer website to learn about different birth control methods where you can go to get them. And powertodecide.org is our main site. And check us out and follow us on social media. And, we're here fighting for you guys. So we'll keep doing it.
Thank you so much.
Well, thank you.
Thank you, everyone.